Hello, my name is Dr. Keith Pearson. I'm Head of Medicines Management for Haywood, Middleton and Rochdale Clinical Commissioning Group, or CCG for short. One of my roles is to help local doctors prescribe better for our local patients, and this short video will help you understand how we actually achieve that role. This video explains why you should only order the medicines you actually need on each occasion. Although medicines are used by most people at some stage in their life, few people actually have a good understanding of the actual costs of medicines. So I hope by giving you a few facts and figures, you'll come to understand it much better. The average price of each prescription item is about £8.20. So if you have 3 items a month, that's approximately £25. Some items, however, are far more expensive. So if you have a respiratory condition and use inhalers, these cost much more generally than £8.20 an item. And so if you have several items, this may equate to £50 or £60. Some patients with more severe conditions who require long-term treatment at a specialist centre, their treatment costs can run into many hundreds or even thousands of pounds each month. Overall, in 2013-2014, the overall expenditure on medicines in England was approximately £14.5 billion. Now that sounds a lot of money, but what does that mean for our population? Our overall budget for prescribing medicines is about 40 million a year, which again sounds a lot of money, and it is, but we really need to make sure that we make the most of that and try and avoid waste wherever possible. Looking at the overall UK budget for medicine of £14.5 billion, it's estimated that approximately £300 million of this is wasted every year by patients who simply don't use their medicine for one reason or another and who take it back to the pharmacy or dispose of it in their household waste. Now, this sounds again a lot of money, but what does that mean in real terms? What it means is approximately £110 million worth of medicines are returned unopened to their local community pharmacists. I think it's important to say at this stage that if you take any medicine back, whether it's been opened or not, to your pharmacist, they will have to simply dispose of it. Any medicines taken back cannot be reused by anybody at any time, and it's simply incinerated. We also think that there's about £90 million of unused medicine simply stored in people's homes. So they've ordered it at some stage, put it in a cupboard and decided for one reason or another simply not to use it. And we also think that for patients in care homes, which are often termed residential or nursing homes, there's another £50 million simply sat there. And as you know, all medicines have an expiry date, and over time, medicines will have to be therefore returned to the pharmacy and destroyed. So what could this pay for? Well, £300 million could pay for approximately 86,000 more hip replacements a year, and about another 100,000 knee replacements, or approximately 20,000 more courses of treatment for breast cancer. Put another way, approximately 12,000 more community nurses. Or finally, 300,000 more courses of treatment for Alzheimer's disease or dementia. For those who don't pay at the pharmacy but pay on an annual basis, we do know that if the cost of medicines increases, there are likely to be increases in the cost of prepayment certificates. So it really is in everybody's interest to make sure that the medicines we order are used and not wasted. What we don't really understand is that why people order medicines and then simply don't take them. It could well be that they've had a bad experience with medicines previously and have felt that this may cause more harm than good. Alternatively, some people believe that as a result of experience of others, that this medication might cause some harms. Some people have said that they don't really understand why they have to take their medicines and therefore adopting a more cautious approach of waiting and seeing before they decide whether they need to take it. But for all of these reasons, we do know that a large amount of the medicines we issue on prescription is simply not taken. It's also important to remember that for all the money we spend on prescriptions that are not used, this reduces the amount of money that we have available to actually spend on other surgical items or care in the community or other referrals into hospital. So each pound we waste is a pound that we cannot spend elsewhere in the health service. So how can we help you? Now, there are a number of ways that patients can be helped in order to only order what they need. Some of you will have heard of the new electronic prescription service, whereby you agree that the pharmacist, whoever you choose, can order medicines on your behalf on a monthly or 3-monthly basis. Before they can do that, they will need to contact you to verify exactly what it is that you need. This service may not be suitable for all, but if you have a busy life or you sometimes forget to order your medicines, then this service may be suitable for you. What you should do is speak to your local community pharmacist who can give you further details, and only then, if you feel it's right for you, you can then agree to this service. Again, importantly, if you change your mind at any stage, you're free to withdraw from the service, and you would just simply notify your community pharmacist that you wish to undertake your own ordering of medicines, and they will stop ordering it on your behalf. Some people, as they get older, might feel that they need some help in remembering to take their medicines. And for that reason, we, in some cases, can give medication in dosette boxes. Now, this isn't suitable for all, as not all medicines are stable in dosette boxes. And some medicines are quite large, particularly those which are soluble, or those which have got calcium or vitamin D preparations in them. These are too large to go in dosette boxes. So this might be a solution if you have a small number of medicines and therefore taking them, but it's definitely not an option for all. What we know is that discussion between your doctor and the pharmacist can help agree which medicines and for which patients that's most suitable, and we can put that into operation. Now, many patients have very busy lives, and it's easy to forget to order your medication in time. Lots of people do it. But what we must do is make sure that for essential medicines, such as people who take medicines for diabetes or high blood pressure, do not stop taking their medication without authorization from their GP. Under these circumstances, if you have forgotten to order your medicine, there is always an emergency supply available to allow you to continue your treatment. What you need to do under these circumstances is, first of all, speak to your local community pharmacist if they're open. We know that not all pharmacists are open on Saturdays or Sundays, but some are. They may be able to help you out in an emergency until your GP surgery opens again. If your pharmacist is closed or unable to help you, what you need to do is call the local out-of-hours service, and the number can be obtained from the telephone directory or by Googling your local out-of-hours service, depending on the area you live in. So, how can we all work together in order to make sure that we make the best of the money that we have to provide care for our local community? Firstly, only order the medicines you actually need. Don't think that you will stockpile them or keep them for a rainy day or just in case of shortages down the line. There are adequate supplies of medicines around for most of our patients. Simply stockpiling them will allow these to go out of date and therefore exacerbate any problems which may develop in the future. You must let your GP or pharmacist know if you've stopped taking any medicines for any reason. They will not get annoyed with you. They will simply want to discuss the reasons why you've decided to stop taking them. If you're having problems with regard to side effects, your GP or pharmacist needs to know that, and often a more suitable alternative can be chosen. You should discuss your treatment and how it's suiting you with your GP or your community pharmacist on a regular basis. Again, if you are having any problems, these can often be overcome. Think very carefully before you tick all the boxes on your repeat order form in order to order all your medicines. If you do not need them, simply don't order them on this occasion. In that way, you're not going to run into overstocking problems. If you need to go into hospital at any stage, please remember to take your medicines with you. If changes are made in hospital, you will be issued with new medication. And in that way, when you come out, you won't be confused as to which medication you actually need to take. Please also remember that your medicines are only prescribed for you. Whilst it may be tempting to help people out who maybe have got a similar condition to you, this can be dangerous, and medicines are very specific and in most cases are for the individual patients, where we know everything we need to know about your condition and the possible adverse effects. If we give them to somebody else, it may actually cause harms. Please remember, Your GP will not be offended if you tell them that you're not taking your medicines for any reason. They really do want to help you get the best from your medicines. So the message at the end of this short video is, please help your GP to help you.